Before I started training, me and my family were actually technically homeless for a year. We had just gotten approved for housing, and I didn't have a job and didn't know how I was going to continue paying for housing or if we were going to end up homeless again. It was really stressful, and so then I decided to try to get in the program and do training just so I could have something more fulfilling and concrete and that I could do to support my family, so we didn't end up back in that situation.
I wanted to get hospital experience, and I wanted to be a nurse as well. So I wanted to start off with becoming a CNA too. You have to have that to get into the hospital. So I did that, and then that would give me, the experience that I needed to put on the application for getting into nursing school. They can see that I have some type of hospital experience. That, and then extra money too for me and the kids to be able to survive and be self-sufficient later on. So I think it's important for me to climb the career ladder. And I started as a caregiver, then became a CNA, CNA 2, LPN, RN, and then I can eventually go on to nurse practitioner, if I want to. I know what it is to be on each level, and I feel like you can always learn no matter what level you on.
This program has helped set me on a path towards what I really should be doing. Working as a CNA helped me see that a lot. Working with the patients and getting their feedback from me makes me realize that having the more direct care was more of how I could help. It's impacted my life in a big way, just setting me towards a path I didn't expect for myself, but I feel like it's where I need to be.
In our program, you can work with your career coach. Your career coach is there to support you every step of the way, help create your steps and create your action plan and your career goal, and move forward from one training to the next and one career position to the next. So your career coach is there to support you in any way that they can and to motivate you into taking the next step in your career. In addition to that, we have specific healthcare trainings, funding for those, and we also have academic support.
In 3 years from now, I definitely see myself being way more stable than I have been in my life for a very, very long time. Idea of being able to support my family with that is very encouraging. My advice to other people that are considering doing healthcare training is, if you can make it work, by all means do it. And even if you think you can't make it work, do it. Because at the time it was kind of stressful and it seemed like this big, huge thing. And looking back, it really was a small chunk of my life that made a huge impact on my future.
If I could give advice to anybody thinking about this program, it would be to do it big time. Having the coach is really helpful. Having their eyes on your path and having just somebody who knows more about the healthcare career and kind of how things can build onto it.
The advice that I would give to other people that are considering training is to figure out what works for you. Don't be afraid to ask for help. And whatever resources that are out there, take advantage of them, because they're there to, help you to get to where you need to be. So I would say, don't be afraid. Go for what you want. The sky's the limit.
I coach my customers because I believe everybody has potential and everybody has the opportunity to have incredible careers and to progress in their careers. And it's my job to accentuate those strengths and talents of the folks that I work with and propel them to have opportune futures. I am a big dreamer myself, and I believe everybody has the opportunity to dream. And not only should they have the opportunity to dream, they should have the opportunity to pursue that dream.
Healthcare workers are in high demand, and ongoing, fast-paced growth is expected as baby boomers age and medical needs increase. By 2025, over 50,000 new workers will be needed in Oregon. There are more than 400 occupations in healthcare, and many don't require a college degree.